Hey y'all, it's the Hormone Hurricane again. Last week we discussed each hormone, how they benefit us, and why we do still need them later in life. This week we're going to talk about the delivery method of each of those hormones and why it's important to take them in a certain way to get the most benefit possible. So we're going to start today with estradiol. Now, estrogen for ladies is made up of estrone, estriol, and estradiol. Estradiol happens to be the only part of that we need beyond childbearing years. Many hormone replacement therapy practices will prescribe something called Biest, and often it's in a cream form. Now, Biest is estriol and estradiol, and the belief is that estriol is going to help combat some of the potential negative side effects of the estradiol. We actually don't see the evidence to support that. In our practice, we forego the estriol. It's just an added expense, basically, and it's not something that's readily available over the counter, or rather at a regular commercial pharmacy. And we do, by the way, recommend to our patients, for the most part, to go ahead and use the commercially available product, just simply because the insurance will cover it at a regular pharmacy. At least most of the hormones, they will. Now, the estradiol can be given by cream. And again, that's that Biest typically, but sometimes it's straight estradiol. Patches are another option for applying estradiol or getting your estradiol. And those are topical applications. You definitely want to avoid those. Pellets are another type of estradiol that you can get, and as well as injections. So those would be an intramuscular. The bad thing about getting it in those ways, I mean, yes, you will see some relief from symptoms, but if it doesn't pass through your liver, then it doesn't stop LDL from oxidating, which means it doesn't help to prevent plaque buildup in your blood vessels. And I mean, everybody wants that, trust me. And when you're taking it orally, it's actually passing through your liver. Okay, and this seems to be something that scares people, or I should say scares the powers that be, and they're putting that message out there. It's bad, it's going to metabolize in your liver and cause problems. The truth is that your natural hormones that your body produces are going to pass through your liver, and it doesn't harm it. So weigh the risks versus the benefits with everything that you're going to do or choose in medicine, and you're going to see with this, the oral estradiol, the risk is minuscule compared to the amazing benefits of taking it orally. So you always want to take your estradiol orally. We do have some cases where an oral dosage, we'll start giving the female patient, the estradiol, and she feels better, but she's still dealing with some vaginal dryness. If you increase the oral dosage, that actually could be too much for her, and she could start to have some of the negative side effects. You could increase the progesterone, but honestly, that would just not be the best idea. What we want to do in those cases, or what we do, is we will give or prescribe a vaginal cream. It's a very, very low dosage, a very small amount. It's applied vaginally twice a week, and it gets rid of that vaginal dryness without getting the estradiol level too high by increasing the oral dosage too much. The patient's body is going to let you know if the dosage is right for them, by the way. So that's it for estradiol. Only oral. Always remember that. Now, progesterone, another hormone that unfortunately is often prescribed in cream form. The problem with a topical progesterone, especially if you ladies have a uterus, you want to keep this in mind, is it actually doesn't get to the uterus as it should. So a very little bit, if any, will make it to the uterus, and that's not good. If your uterus is receiving that estradiol and not getting the progesterone, that lining is going to build, and that's going to cause a lot of complications. There actually have been cases, sadly, in this field where women have died of uterine cancer because that methodology or that method of delivery was used. So you want to avoid that. Always take an oral progesterone. It's absolutely wonderful. You want to make sure to protect your uterus. If you don't have a uterus, Personally, I would advise every lady to avoid the progesterone creams. So yeah, if you don't have a uterus, you don't quite have that risk, but there are other organs in your body who need the progesterone, and so you want to take it orally to get the most benefit, and that's the bottom line there. For testosterone, so creams are not the worst thing in the world, but unfortunately, with the cream and the topical application, what you're going to be dealing with is, according to one of the compounding pharmacists that I know and I've known for years, a 50% bioavailability rate. Now, let me pause for a second and say that's actually true for any cream hormone that you're applying topically. You're only going to absorb about half of it. They're a lot more expensive, plus you have to do them every single day. With the testosterone, if a man is using a topical version, just to let you guys know, anybody who's doing it, don't apply it to the least hairy area of your body. What you really want to do is apply it directly to the scrotum. It needs to be done twice daily. You're going to get the most absorption that way, by the way. So with the topical application, again, of the testosterone, unfortunately, what ends up happening is that causes a higher level of DHT. DHT is good for you unless you are genetically predisposed to male pattern baldness. And yes, that is also something that women deal with. It's not specific just to men. So that's going to cause more hair loss than would be happening if you were taking the injectable form, which is what we prescribe. We prescribe testosterone cypionate and then also enanthate once in a while. That's basically based on the patient's preference. If they've been on it before, they'll come to our practice and transfer in, and they will request to continue using it. We honor that. Pellets are another way to get your testosterone, and again, it is inserted into the muscle, so it would be considered the same as that injection intramuscular. But pellets are something that we will never do in our practice. There are about a dozen reasons. You basically begin to build enough scar tissue in the areas where they are supposed to be inserted that after many insertions and over a period of time, you're not going to be able to insert there anymore. The body does recognize them as a foreign object, and then it will begin expelling them. So let me just say, I have seen that before, and it's not a pleasant process when you're healed, because we have to basically numb you up, make another incision, remove the pellet, and again, it's just not fun. The compression of those pellets is going to determine how they deliver the hormones to your system. So if they are compressed too tightly, they're not going to release enough of the hormones into your system. If they are compressed too loosely, they're actually going to dump the hormones a lot quicker into your system. And either way, you're stuck for about 12 weeks to 16 weeks, depending on the protocols that the doctors are following with insertions, of feeling the way that you feel, and there's not much you can do about it. The other part of that is that with pellet insertions, you're actually going to feel good for about a month and a half if they're compressed properly. And then it's just a slow decline for the next couple months. And again, it's just not a pleasant process. Now, I want to say real quickly about the rejection, the pellets being expelled by the body. I was told recently, oh no, my doctor says there are new pellets out that have a special coating on them that prevents the body from rejecting them. My first thought was, aren't we kind of defeating the purpose? I mean, we're trying to use hormones that are as natural as possible and exactly what our bodies produce so that our bodies recognize it as its own. Why are we now starting to add more chemicals? And if you have to add more chemicals that way, just why do that? Why not go for the version that your body will accept and there's no chance of the body rejecting it? So yes, definitely would use, and we do injectable testosterone cypionate for the most part for both men and women. It's inexpensive. For ladies, it's once a week. For men, we have you divide that dosage up into 2 injections, so you do it twice a week. I will say that some of the negative side effects that can happen with the testosterone, some of that is based on, well, it might just be too much for that patient's body. But in some some cases, when you drop that dosage down and get rid of the negative side effects, they're still not feeling quite up to par. So there are some other protocols, believe it or not, where you can inject the testosterone subcutaneously. You would drop the dosage, or for instance, if you're doing 200 milligrams a week as a male, then you're going to divide that into 7 and do a small subcutaneous injection every single day. But we'll talk more about that at another time. Now, the other hormones are, that we address in our practice are going to be thyroid, so that's a T3 and T4 combo, DHEA, and vitamin D3. There are no other options to take that currently except for orally, so not a problem with those. For now, we're going to end the discussion today. Please do like, follow, and subscribe. Head over to my Facebook page. Give me a follow there. It really does help. What I'm trying to do is just get the word out, the information, so that people know there are other options other than the brick wall that their doctor offers them to bang their head against. For now, this is the Hormone Hurricane signing off, and I hope you guys have a fantastic week.